Hello, I am Professor Francesco Giorgino, and on behalf of my co-authors, I would like to present an overview of our article entitled Adherence to Antihyperglycemic Medications and GLP1 Receptor Agonists in Type 2 Diabetes. Firstly, most patients with Type 2 diabetes are prescribed antihyperglycemic medications, but adherence is often poor and unrecognized by the prescribing physician. Indeed, according to the World Health Organization, adherence to long-term therapy for chronic asymptomatic diseases such as type 2 diabetes averages about 50% in developed countries and is likely to be lower in developing countries. Importantly, poor adherence to antihyperglycemic medications can lead to suboptimal glycemic control, as well as increased risk of diabetic complications, hospitalization, and thus inappropriate use of healthcare resources. In addition, poor adherence may occur regardless of the specific antihyperglycemic regimen used, and apparently with both oral and injectable therapies. With this in mind, in our comprehensive review, we discuss several aspects of adherence to antihyperglycemic medications. These include how adherence is defined and measured, the extent of poor adherence, reasons for poor adherence, clinical consequences of poor adherence, and strategies to improve adherence. Notably, among those factors that are especially important in increasing adherence to injectable antihyperglycemic medications, improvements in drug administration regimen, formulation, and delivery devices play an important role. In fact, advances in this area are an important theme in our review, in which we focus on the evolution in the drug class of glucagon-like peptide 1 or GLP1 receptor agonists, all of which require subcutaneous injection. As you may know, as the GLP1 receptor agonists have evolved, administration schedules have become more convenient in terms of dosing frequency. For example, Dulaglutide, albiglutide, and one of the formulations of exenatide are administered just once weekly. Several studies support a relationship between reduced dosing frequency, greater preference from the patient's perspective, and improved adherence with GLP1 receptor agonists. Another point is that advances in drug formulation may also increase adherence. For example, there are differences in reconstitution and preparation procedures prior to administration. Of note, among the once-weekly GLP1 receptor agonists, Dulaglutide single-dose prefilled pens are the only formulation with active drug already in solution and ready to use without the need for mixing or attaching a needle. Interestingly, findings of a large observational study with a 6-month follow-up period showed significantly better adherence and persistence with once-weekly Dulaglutide than with once-weekly exenatide or once-weekly liraglutide. Moreover, these conclusions are supported by data suggesting that patient reluctance to use injectable therapy may be overcome by use of a patient-friendly delivery device. In summary, using evolution of the class of GLP1 receptor agonists as an example, our review illustrates how advances in drug technology resulting in less frequent dosing and improved devices for drug administration can lead to better adherence and, in turn, may help to achieve better clinical outcomes.